So let us learn about esophageal web. So when someone presents with difficulty swallowing, otherwise known as dysphagia, you want to figure out whether it is oropharyngeal dysphagia or esophageal dysphagia. Oropharyngeal dysphagia is when someone presents with difficulty swallowing and the food doesn't go from the mouth to the esophagus, and in the process it can get into the windpipe or the trachea, resulting in aspiration, or sometimes it can come out of the nose. That is nasal regurgitation. And when it comes to esophageal dysphagia, there are a number of reasons, and one of the reasons is esophageal web or post-cricoid web that is located just at the upper end of the esophagus, below the upper esophageal sphincter. So let us learn a little more about this problem by reviewing the story of this woman who has developed esophageal web in the post-cricoid area or post-cricoid esophageal web. She is in her 50s and she has been having difficulty swallowing for a few months. And in addition to difficulty swallowing solids, she doesn't have any other problems. She complains of weakness, fatigue, shortness of breath, otherwise known as dyspnea, and heart palpitations. And she also complains that her nails have changed to spoon-shaped nails. And she complains that her tongue is red and inflamed, that is glossitis, and her angles of her mouth tend to crack, otherwise known as angular stomatitis. So this story is typical for what is known as Plummer-Vinson syndrome. So let us see what happens when you look at her pathology for her difficulty swallowing. So here there is a web, like a thin membrane that developed in the upper esophagus just below the upper esophageal sphincter, and the sphincter is located close to the cricoid, and it is also known as post-cricoid web. And let us see how it looks on endoscopy. So we pass the scope through the upper esophageal sphincter, and the scope is positioned just below the sphincter, and you see the lumen as shown by the red marker, and then as you go up you see the web, thin membranous web that may catch on the food and make someone feel that difficulty swallowing, and they tend to show that with their hand close to the neck and say this is where the food gets stuck as it is going down. And how do you manage this problem? You may want to consider dilation. You could rupture that web with a large bore bougie dilator, and this is a savory dilator. You could pass a big dilator, 18 to 20 millimeters in size, or you could also use a balloon and try to rupture that membrane using a big balloon between 18 to 20 millimeters in size. In addition, it is also important to treat her anemia. She has spoon-shaped nails, she has glossitis, she has angular stomatitis, And when you look at her blood counts, it will show features of iron deficiency anemia that also needs to be treated. And one needs to figure out why this woman developed iron deficiency, and that also needs to be addressed. I would like to thank Dr. Stroline for the professorship, Mr. Charles Butt of HEB, and illustrator Miss Angela Deal for their support. Thank you.